So, Assalamu alaikum and good evening and hello to everyone. I'm Dr. Mohammed Waqas from Maldives, and today here actually Friday is public holiday, weekly holiday, not like Sunday. It's like UAE here. Just want to know if anyone who is attending this live broadcast, can you hear my voice? As I have posted on my Facebook page, on my YouTube channel, that whatever questions I will be getting from you guys, I will come online today 9 p.m. and if you can hear me, thank you Dr. Abdullah Subhani for answering. Yes, thank you and welcome to my live. Today with me will be Vigil. He's from India and he's a registered nurse here. And first of all, I will take questions from the medical officers, doctors, and other people who are interested to come to Maldives to work in health sector, and then we will take some questions from nurses. I will be answering whatever you guys want to know. Right now, I am working in Himafushi Health Center. It is government health center. I'm working for Ministry of Health, as you already know me from my YouTube channel. So anyone of you, if want to ask something, I'm here available. So yes, this two guys who are viewing me right now talking, I don't want to waste you guys' time. Most of the questions I get from people, especially first I will talk about doctors. They want to know that how they can get job. This is the most important thing they want to know, that how they can secure a job easily in Maldives. So I will speak about this and I spoke about this already with you. It's my second year working here with Ministry of Health. The experience is not very good, not very bad, it's average. Okay, so Abdullah Subhani, how we can get medical officer job in Maldives? Dear Abdullah, actually there are multiple ways to secure a job in Maldives. The most easiest and convenient way, because it is not like working in your country, it is like working in another country which is like overseas, and you don't know, you know nothing how things go there, right? So the most easiest way is through agencies. There are many agencies which are working, and the second way is direct applying method. Applying, you have to apply directly. To apply directly, there are two sectors. As I already told you guys that I'm working here in Maldives for Ministry of Health, and my experience is not very good, not very bad. So you are telling that I sent my documents to Ministry of Health Maldives 1 month back, but I don't get any response. So yeah, this is what I want to say. First of all, you have to apply directly. If you want to work with Ministry of Health, they will get your CV. Of course, when you email them, they will get your CV. But what about the people who are having more experience and who are applying through agencies? Agencies definitely have their contacts with Ministry. They are working side by side with Ministry, and definitely Ministry will give priority to agencies. Why this happened? Actually, it's not about taking money from people. Why this happened? Because Ministry needs people who have real experience, registered doctors, registered nurses. That is why Ministry are involving some agencies which are trustworthy, not only for the doctors, not only for the Ministry, but also for the doctors, like the doctors who want to come here, that agency should guide them in the right way. And similarly, that agency should guide ministry about the candidate they are bringing. Before, what was happening, anyone who was bearing MBBS degree or any other MD degree, they were actually having no experience, no internships, and like I would say, the kind of doctor, the medical officer who is required to work in an island, because sometimes you are alone in the island, and government, this Ministry of Health is a government, you can say government institute, right? It's a government institute, and they don't want anyone who who is himself helpless to tackle with acute emergencies. So yeah, so this is one point which I wanted to let you guys know. Okay, the next question which I would say by myself, which I will put by myself, that which agency actually, the agency which charges in advance, or the agency who charges nothing in advance? I always recommend you guys the agency which charges nothing in advance, because that is because you are not sure about people, right? Okay, agency demand almost 5-year experience for medical officer. That is impossible for an MO, right? People who want to come here, they are looking for a job that is easy, that they can study here, they can spend some time to complete their higher education, which I would say their higher goals, to settle in Australia, England, or anywhere else. They want to prepare that, right? So that is impossible for a MO. All right, the people who have these higher goals, they will be one who are making these plans from the last final year from the university. So with me, Vigil is now, he got me in the comment section. Thank you, Vigil, for answering this. That please send your CV over and over again until you get a response. As doctor said, it is easier if your approach is by agency. Yeah. So could you recommend some agencies? The agencies which I came through, I will list only the name of that agency because I have practical experience with that. That does not mean that other people or agencies who are working with ministry, who have the same opportunity like that agency, they are fake or they are unreal. Definitely they are real also. But I have experience with there is an agency running by Dr. Kareem Mandu. You already know, it's a DFM group, Doctors for Maldives group. I came through that. It is a time-taking process. One thing I will tell you guys: when you leave a job from somewhere, whether it is your government sector, whether it is your private sector, it takes 2 months to leave a job place, right? I am right. I think I am making sense. So how can you expect that if you are looking for a new job, you will get just in a couple of months? It will take months, 3 months, 4 months, 5 months, 6 months. Especially it is overseas, right? It is not in your country. If in your country you want to join a new job, you will get it in months. So it is overseas. Here things are different than our countries, India, Pakistan. So as my respected my colleague Vigil Vergheese Valloroon says, that if you want to apply through government, then you have to, like directly to Ministry of Health, just send your CV over and over again until you get a response. If you don't get a response, this is the real point. You want a job, you don't have time, you want to get it in months. The real point is you must have to have the name, the trusted agencies with you. There are some agencies who are other than this DFM group, and I will be right now I don't have their contact numbers, but I will be posting them to people who are messaging me privately. I will send them their names and contact numbers, like who are not taking anything in advance. If you are giving someone in advance, I have seen people who are hiring medical officers while charging them something in advance, and they are coming here and working here also, and those are trusted agencies. Well, but if you give them something in advance, that's up to you only. Okay, so how can okay, Abdullah Subhani says, could you recommend some agencies? I told you guys, if you message me, I will send you those contacts definitely. Secondly, how can I fill the form present on ministry present on MOH? How can I fill the form present on MOH? Okay, Miss Sahar Afshin is asking, and how to send it. So yeah, forms are downloadable from the Ministry of Health website, as Vigil has answered your questions. And the question which I understood, please correct me, you want to know how to fill that form which is present on MOH website. You can fill that by hand, as someone sent me this message. How to fill? Is it by pencil? Can we have to type on a PDF writing website, or do we have to write by hand? You can write by hand, you can type on computer, that's up to you. And sending is just attach it with the email and send them. It's just very easy. What difficulties, can you tell me what difficulties you are getting while filling that form? Can you tell me, Miss Arafshin? Then Abdullah Subhani is again asking how to get resort doctor jobs. So there are 375 resorts. So 375 resorts need 375 doctors. Plus there are hundreds of government health, there are 300 islands and 300 health centers. Like there are opportunities equally in resort and Ministry of Health medical officer jobs. Recently, Ministry of Health posted 40 medical officer jobs 2 days before. That ad is available on the Doctors for Maldives group page also, and Ministry of Health website. I think it's available there. I didn't check, but they have recently announced 40 medical officer jobs there. And the resort doctor job is there is a website. It is called job-maldives.com, and there is one more website. It's called coral.glassmarket.com. I will share both of these websites name also. Like you have to apply directly to the resort. Name the resort on the Google. You have to search on jobs-maldives.com. There will be categories on the left side which you will be seeing, and you have to click on that resort name. If there are job vacancies, you will see the form and you can apply through that. And there are also some other forms available on that website, like health sector jobs are there on that website. I'm a fresh graduate. How many charges are there for me to get the MO job? Chances are there. I mean, you want to write. Fresh graduates have equal chances to get the job in resort, but less chances with Ministry of Health. Ministry prefers people who are more experienced, maybe having at least 2-year experience. And as I have said that if you are applying through agency, you get the equal chances with the people who are senior, because you are paying something to them. You understand me? If you are applying yourself, there will be lesser chances. If you are applying through agency, you will get almost the equal chances. If you are a fresh graduate, have 1-year experience, or you are a senior, but agency will give you a lot of push to get the job, to secure the job. So experience is not a big issue here. Whoever is mentioning 5 years MO experience or 2 years MO experience, I think that is just to get they know hundreds and thousands of doctors are interested to come in Maldives, and they want to present themselves like we have the best ones. So that's why their ministry don't have any issue if there is a licensed doctor who has 1 year experience. No issue is there. You can get a job. You must be having any country's license with you. And I want to talk about resort doctor and government doctor job. Resort doctor job is more beneficial. Like that job is more beneficent for you as compared to Ministry of Health job. There are pros and cons in both jobs. In Ministry of Health jobs, you have to be on the island. You will have some opportunity to bring your family. If you are married, you can bring them with you. They can live there. In if there are 300 or 400 resorts, only I think couple of them or 3 4 of them are allowing the family to bring there, and your family won't have any school on the resort if you are having kids there. Like this is one issue. The beneficent is just because the salary in resort is more and they are paying you in US dollars. Ministry will pay you in Maldivian rupiah. So and the salary is 6,600 $700 more than as compared to Ministry of Health job. So how to make one's CV attractive for the employer? What exactly are the requirements they demand expect from a medical officer? Mohsin Nazir is asking me this question. So thank you, Mohsin. You have asked me a very good question. The CV should be having one thing, which is, we can say, when you you have finished with your profile name, your country and address, email, contact, Viber, WhatsApp number, then you have to have your recent experience. Where are you currently working? You have to mention that there. Yeah, you are working in some hospital, tertiary care hospital. That is the attractive thing. And your CV must be attractive. Like it should have a profile photo with it. It should be written. It should be written in a way that is attractive, like very colorful. You understand me? Like in Maldives, you will be getting this like they like more attractive things. If your CV is just the old fashioned, it maybe not impress them. Whether you have published many researches in the last paper, maybe it will be put aside. But definitely you have to have a good attractive CV with a profile picture with it and a recent experience or current job you have to mention after your profile section. Start with your experience. Currently you are working here, then your past work experience, then your education and everything. And then Sairab Singh, I have recently finished my house job. Is this possible to get it? Of course there is a job. You will get your license after finishing your house job. So you can get a job there. Kindly recommend some agency for resort doctor jobs. We do not take money in advance. Agency for resort doctor jobs. Actually, resort doctors are not working. There is one. There is a company. It is called MedPlus. That company is hiring doctors for resorts. What they do is they take some part of their salary. For example, if a resort is offering $2,400 to a medical officer or doctor, that agency what it will do, that agency, that MedPlus, what they do will be that agency will take some commission from their salary every month. Okay, I'm not naming that MedPlus is doing it, because I am not working with them. I don't know, but what I know of is that MedPlus is actually is taking some is responsible to pay the salary to the doctors. They take their salary from the resort and they are paying to doctors. Like doctor cannot ask resort to pay them because they are hired by MedPlus company. So MedPlus is one company which is hiring doctors for resort. But I would say you have to visit that website, job-maldives.com, and you will be having lot of recent posted jobs. Maybe today there is a job posted for medical officer. You have to post it there. And agencies, same agencies that Doctor for Maldives group or other agencies, I will message you guys in person. They will hire. So yeah, Hi, can female Muslim doctor wear niqab during duty? Yes, Vigil has answered that yes, Maldives is a Muslim country as well. Of course, Maldives is a Muslim country, and I think this is the most highest intermixed culture which is present on earth right now, this Maldives islands, because whichever island you go, you will find people from every country, from Australia to England to Philippines, India, Bangladesh, Pakistan. Like there are so many nationalities are there working, because they are outsourcing for every, not for even health sector, they are outsourcing people for their construction jobs, uh, for uh, um, for tourism, for everything. You will find like so. It is a Muslim country, but you will be seeing people who are following their culture in here, and there is no issue. For example, I can tell you an example. If you are Muslim, you want to wear niqab. In which health center you are working, you have to tell them that I want to wear niqab during my job. So it is not mandatory to wear or remove niqab, but you can tell them. Mostly women in Maldives, they do a scarf, their head scarf. Their face is visible, and they are wearing an abaya, like you see in Kingdom of Saudi Arabia. You understand me, like burqa, which is we call it. And women here, they are wearing this. I can give you an example of a patient. She came with the ear infection in my OPD time, and she asked me. I told her that because of humidity, you have to uncover your ear. So she says that, doctor, how can I show my ear? I have to wear this scarf all the time. So this is how they are conscious about, because they are Muslim and they are following this scarf thing. But at the same time, the culture is intermixed. At the same time, their culture is intermixed. You will see people following their own culture. For example, every island is having a bikini beach there. Every island is having that local beach there. Like there is a bikini beach, there is a local beach. So local beach, local island people, they go to their local island, and on bikini beach, the people who are wearing, like women who are wearing bikinis, and tourists are there. For example, there is a, so what now tourism ministry says that they have put a small curtain over the side, which is visible to people. So people who are coming here for tourism, they don't get disturbed from locals, and locals don't get disturbed from them, because they are two different cultures. So now I can see, okay, next question. Jude Sujivan is asking from Georgia. A graduate from Georgia and currently working in Sri Lanka as a medical officer with 5 years experience. So Jude want to know, let me just see, I have his message is just somewhere. Yeah. Unfortunately, my university name is not in the list of Maldives Medical Council. In this case, how can I apply? So my university name is not also on the MMDC list, and I am working here from AC for 2 years, because I have gone through my CV got shortlisted. I have gone through online interview and online interview. So I have gone through an online interview also. So after that, after passing that, I came here, and now I have signed contract with the ministry themselves. So it's not a big deal. That list, I think, is obsolete now. It's not worth it to rely on that. I think it's not updated. In ads of doctors of Maldives, they always ask for at least 1 year experience. Of course, they need 1 year experience. What about OET or IELTS? You don't need OET or IELTS before coming here. The more the experience, the more are the chances. Exactly. At Sham server, hi, hello, how are you? Alhamdulillah, I'm fine. Can we travel between the islands? as it mentioned. Atisham, how are you? I hope you are all right also. Can we travel between the islands as it mentioned on application form? We can't. Um yeah, okay, let it be just on the paper, okay? But when you come here, you work with them. There will be many opportunities for you to enjoy. It's same like as when you have your good reputation between them, you work with them as you have to. Like it's your own country. Like we work in our own country, we work by heart. You will get plenty of ample opportunities to go. Yes, me and Vigil, we both are working in Maldives together. Vigil is Vigil. Can you send me a request? I can. Uh, I can. I want to take you with me. Let's talk something about nurses. I want you, if you want, if you can share something about nurses. Can you send me a request? I will take you. So Vigil is from India. I am from Pakistan. We are working together in the same health center, and he's working as a registered nurse. I'm working as a medical officer, and it's been almost 2 years. And we are working here. We are playing football together here. We are going swimming together. Like we are enjoying life here. So it is really good environment. You will get experience. So I will add Vigil now with me. So he is working as a registered nurse. I have sent my documents to DFM. I want to know how they conduct interview and what they ask in interview. So Abdullah, actually, this is a question which actually answered by should be answered by. Um, Hello, welcome, Vigil.
Hello, sir.
Vigil.
Thank you.
Yeah. So actually, this have to be answered by doctors from all this group. But actually, I am here with this video. I can guide you regarding interview. For
Sure,
interview,
sir.
they will ask you main questions from the acute emergencies you see. For example, there are five things I will tell you from the start. One thing is that you have to be online on time, which they gave you. Second, if they are not sending you greetings on time, you have to send them greetings. Third is you have to be wearing a good suit with a tie, because that is a dress code for a doctor to wear here when he goes for OPD, which tie is not be we are following, but other dress shirt and pant we are wearing the same. And you have to be down to earth. You have to start with your introduction, and then they will be asking you the main questions, not very difficult, but the main emergencies which you encounter while working while working anywhere as a medical officer. Like, for example, how you suspect someone as a heart patient, a chest pain patient, how will you manage him or her? So this is how they will ask you. So Vijil, let's talk about nurses in Maldives. How you are working here for 5 years,
Yes, sir.
and
Yeah, 4 years completed, and this is my
four
fifth year,
years
sir.
almost complete.
Yeah,
So,
yeah.
and I found you a very experienced and
Thank you.
a very experienced nurse. Tell me how do you recommend nurses to work here for? I will recommend doctors to not work here for more than 2 years. You tell me how you.
Yeah, 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 yeah. Yeah, it's a mixed thing, Some of them they have to relax, they don't want that hush hush busy thing. So, as you know, Maldives is a very good place to work, relax, like you don't have to work hard,
Yeah.
there is no hush bush, nothing. So, especially if you are in a health center. As you know, it's very easy for a
Easy,
nurse
yeah, easy job.
to carry
I
forward.
personally get only six, seven patients on a normal day, or 10 patients maximum.
Yeah,
And
it
10
varies,
patients,
yeah.
yeah, 10
Man,
patients we
yeah.
have to work. And on night OPD, we will get most of the patients. It is like 8, 10, 15, this kind of number. But we don't get to this point which you mentioned, that work is not hard here. You will get ample time, whatever you want to do, right?
Yes, sir. Yeah, yes, I did. So,
So tell
what
me
I
about,
recommend is,
tell me for the nurses. Actually, I
yeah,
want to
yes,
know
sir.
the salary of the nurses
Um,
for
so,
Ministry of
yeah,
Health.
and I will tell you the details. Let me explain in detail. The thing is that first of all, the plus point coming to Maldives is you don't have to score a big IELTS or OET ranking. You just need, only 5.5 or band C. If you have, you can come and join in Maldives. And of course, a 2 year experience is needed, and you have to be still working. So if you fulfill this criteria, you are okay to go. So the thing is that you don't have enough work in a health center, like it is very relaxed. There will be staff, and even if you it's very easy to
Yeah,
work
I
here.
will tell you. I will add one thing here. I was working as a ICU medical officer in Pakistan, and
Yeah,
I
I am
worked as a
also
registrar.
was working
Yeah,
in
you were
ICU and
also working
dialysis
in
as well.
ICU, and I worked as a registrar in a medical office, emergency medical registrar in Pakistan. And you were working which city of India?
I was in Pune and Goa as well.
Yeah, so you work in Goa and Pune. I work in Lahore in a tertiary care hospital. And imagine I worked as a registrar. When I came here, I couldn't find much work to do, and I was getting panic.
Yeah,
Like, what should I do? Where should I put my mind to work? Like, then I blamed
yeah,
myself
it is.
in
It is a
exams.
fact,
You know that I made my
you
mind.
may forget, you'll forget everything. You'll start forgetting everything day by day.
Yeah, our mind. So now I think that after 2 years, my mind is getting on a certain level of peace, which can get disturbed
Sorry,
by
there is
something. Yeah,
there is
which
network
can get
issue.
disturbed by anything, but not from burden of patience.
Yeah,
So
yeah,
I have
that's correct.
taken Plab 1 here. I went to Sri Lanka. I took Plab 1 there. You know that. Uh,
Yeah,
in Pakistan, I couldn't even imagine of taking Plab 1 in such a short time, but I took it. So
yeah,
let's take a question, Vigil. Amir Zulfikar is
yeah.
asking, I'm fresh graduate and done with my house job. How to overcome this experience thing? So if you are done with your house job and you have your license, I'm repeating this again. You can apply. You can apply through agency. You have your chances if you have your license with you. Same goes with the nurses, right? They have to have their license to put them on the list of.
Yeah, actually, there should be 2 years of experience. It is a must. It's mandatory to have
2 years
2 year
experience is
experience.
not for
Yeah,
nurses, right?
because like a staff who didn't have this 2 year experience had to go, had to resign and go. So I request you to have, you must have a 2 year experience before you join.
So if a
And
nurse doesn't have 2 years
you have to
experience,
be still working as well. Yeah, they ask for a still working certificate. Mostly they ask it. Yeah.
okay, okay. So if a nurse doesn't have 2 years experience, they don't hire them, or they hire them, on what conditions they hire them?
The thing is that they only check the details when you register in the, after passing the MOHS. One thing I have forgot to tell you is that you have to pass the Ministry of Health exam for nurses, and that will be a computer-based exam. But the thing is that some When I wrote the exam, it was somewhat like not easy, not hard. But nowadays, newly joined nurses say that it is very difficult to pass the exam. I don't know like I don't know what's going on. But some of the nurses are trying to get the exam passed in multiple attempts.
They
So
are
that is
finding it
also a
very
factor.
difficult now, right? So then
Yeah, nowadays it's difficult.
the nurses have to have their 2 years experience. When
Yeah,
they come here,
yeah,
I had to pass MMDC exam, license exam here.
yeah.
You also had to pass
So yeah,
the
yeah.
exam for
We
nurses.
nurses are also have to pass the exam, and then only and up to then they will get a provisional registration. And then after passing the exam, you will get a permanent registration that has to be renewed 2 yearly.
Yeah, the
So
question is,
the thing is that
you
so you
have to take
I
exam within 6 months, right? Nurses have to take exam within
yeah,
6 months.
within 6 months.
If
Yeah,
you
yeah,
don't take
within
exam
six
within
months.
6 months, that exam held every month. You can attempt
Yes,
it
yeah,
after.
most of the exams are there almost every month, and you have to appear for the exam. And I think if you don't pass in 6 attempts, I mean, within 6 months, you cannot work. And then you have to clear the exam, and then only you can work.
Okay. And
Mm.
what
And
about
then the thing is that they check the experience certificate and all when you go to register. And by the time, before you join, if you don't have this 2 year experience, then it will be difficult. They might send you back. Most probably they
Mhm.
will send you back. So 2 months, I mean 2 year experience is mandatory.
2 year experience is mandatory for the nurses, and for
Yeah.
doctors actually there is no must thing. If you have 1 year
Mm.
experience and you have your license, you have done your house job, you can take the job here, you can get the job there, and you have 1 year, one full year to take MMDC exam every month, which is held every month. And for nurses, this exam have to be passed within 6 months. So for nurses, the scrutiny and the exam thing is a little tighter as compared to doctors. And Abdullah Subhani is asking that is there any OET or IELTS center in Maldives? Yes, there is IELTS center in Malé city, which is capital, and there is no OET, but you can take OET at home as you already know. The nearest place to take PLAB or MRCP exam is Sri Lanka. The flight is 1 hour from here, and also India. You can travel India. India is sharing border with Maldives, and you can go. You can take a flight which I think takes half an hour to reach India to take any exam there. And
Correct me, it's one and a half
no direct
to
flight to
one
Pakistan.
and a half and more. Yeah, one and a
Yeah,
half
there is
hours
no
to reach
direct
India.
flight to Pakistan. Yes. Yeah, please. What you were saying something, Eugene?
Yeah, 1.5 hours to reach India. At least
One
one
and
and
a
a
half
half hours.
hour to India, Kerala, right? Kerala.
Yeah, to
Okay.
Kerala, and if you go to some other places, it will be more.
So Salman Shohab, you are asking about 40 seats for medical officers. Ministry has announced recently 2 days ago. So these 40 seats for last 2 years, I haven't saw any this big number of seats announced by ministry, and I'm very delighted by this that now they are hiring more doctors as compared to past. For last 2 years, I haven't have the maximum number of vacancies for doctors they post was 15. Now it's 40. In our I am in Kafu Atoll, which has the capital. Me and Vigil, we both are in Kafu Atoll in the same health center, and in our health center, two or three doctors are some island. There are some doctors have resigned, I think, and same as in the far islands, there are so many depletion for doctors, medical officers. So I think this 40 medical officer thing is true, and you have to get your chance. How many candidates will apply? So many candidates will apply. I think. Yeah, because people from Egypt, I have worked with doctors from Egypt, from Sri Lanka, from India, Nepal, Pakistan, Bangladesh. Currently, my colleague, my fellow doctors who is working with me, she is from Bangladesh. So many countries doctors will apply for those jobs. 2 years experience is enough for a medical officer doctor. So Vigil, nurses, they have their own council here, right? Allied
Yes, sir. No, Maldives Nursing Council is there.
Maldives Nursing Council is there. So what about salary for we are getting a salary of like $1,800 as a medical officer per month, other than overtime.
Yeah, almost $1,000. I'm not sure with the dollar thing, like, in rupiah,
So
it is
thousand
around
dollars is
21 rupiah. Yeah,
you
20,
can
21 rupiah.
overtime there, right?
Overtime,
Overtime.
yeah, you'll get overtime as well. With overtime, it depends, So, if you work on Fridays, it will be more, and public holidays and Fridays, they will give you more overtime. So, it depends upon the holidays and your duties.
So now actually you are asking the ratio, the percentage you want to know. Dear, I told already that if you are applying through any agency, you will get more chances.
Mr.
Uh,
Shoaib has asked, should I apply through an agent or should I apply on Ministry of Health website? I recommend you to apply through an agent because the Ministry of Health people, the people, the agents who will be behind their back, so things will be easier and faster. So if you apply directly, they will hardly reply to your emails. You have to forward your CVs over and over again. So, once that people, many CVs will be, they will be receiving. So, they might not see your CV. If they see, it will take some time, to get a reply. So, if you apply through an agency, things will be easier, I guess.
so we have 5 minutes for our broadcast, or 10 minutes left. Any other questions, you guys? Vigil, anything you want to share, yeah, regarding nurses
Yeah,
job?
for nurses, as I told you,
How
like
do you
those
feel,
who want
how
to
do you
come,
feel about it? I want to know
you know,
your perspective as you have much
my
experience.
perspective, yeah, yes, sir. My perspective is that, the people who are writing, IELTS and OET, they try very hard. Sometimes they don't get. So some of them may not get the score. You know that. So it is very easy to get a job in Maldives if you have at least 5.5 overall 5.5 in IELTS and C band in OET. So that
For
is a
nursing, for
minimum score
nursing
actually.
person, right?
So the other thing is that after coming here, you can prepare for the exams online and you can go to your dream place. So you will have enough time, I guess. So this is an opportunity actually. This is like you can do your job, you can get some salary, and a good salary, not bad actually. So by the time you can prepare for the exams as well, and yeah, you can go
You
to
can
your
make
dream
the,
place,
it is actually,
or or
actually a
some,
transit. It is actually a transit for doctors and nurses.
yeah,
They
yeah,
can get
they said it.
they can get their CV don't get disturbed while working here. They are still working here as a nurses or doctors, and they can get prepared for any exam they want in the world. And it's just a route which they can take. They will have ample time to study here for any exam. Many nurses, as you said, they want to go to Ireland. The mandatory requirement is at least to take OET or IELTS here. So they will get ample time here to study for anything. As I said, so many people from here they went to Ireland, Australia, PLAB because job here is not very tight, not very hard. So Salman Shohab is asking that someone was asking him to deposit 500 USD before anything. Should we trust them? So this trust part, I already mentioned, it is personal. We don't know whom to you have to trust. I always recommend trust an agency which is not asking anything from you in advance. If someone is asking, that is on to you. If you heard of if you know someone who came here through them, and you know that this agency has good reputation, good reviews, I mean, they have a page, they have contact number, they have their location, you can trust them. Otherwise, I am against paying anything in advance to any agency before coming. I didn't pay
So,
anything in advance.
yeah, so as you said, asking 500 USD, I think I would say you should not give because
Hmm.
first of all, a reputed agent will not ask this much amount of money to pay in advance. First thing is
Exactly.
that. The second thing is that if you want to pay anything, you give them only after receiving your offer letter or something like that.
Hmm.
You have to have some confirmation. No, 500 USD is not a small amount in my perspective. So yeah, I feel like it's
Doctor,
better. Yeah,
mhm. Yeah.
you could
As a
give a
doctor,
smaller
I would
amount.
say, yeah, please continue.
Yeah, you could give a smaller amount if you want like 200 something. Like just for the paperwork or something. They would be something they would be doing. So I request you don't give a humongous amount
Hmm.
in advance. And the other thing is that do not give your passport before you get any assurance.
Yeah.
So
You are not to give
even
passport to anyone.
actually, you don't have to hand over your passports to any agencies before you reach here because there is no need of that. Only thing is that you can give them copies. Only you give copies because
Hmm.
the visa will be stamped only after coming here. So there is no
Hmm.
need of passport to be handed over to any agencies because the thing is that when once they get the passport, they will bargain with you like, yeah, we have done this much of paperwork, so you have to pay this much of money, only then only we can give you the passport. So that should not be there.
So Salman Shahab is asking any agency. I don't know which agency for doctors in India, but there is I know which I have experienced that doctors from Maldives group that is running by an Egyptian doctor here. That is actually is a one agency I would recommend, but I don't know other one. He said, I'm good. Can you tell us
Yeah,
where are you from, Salman Shahab, India or Pakistan? As I, if you are from India, Vigil will guide you regarding agencies there. I don't know. Maybe.
actually in India there are many agencies, but only a few of them are trustworthy. Like they also do the same thing.
If
Like
someone
they
is
will ask
asking, yeah.
money in
So
advance and
Salman
they will do
from
the paperwork.
Pakistan, yeah, from Pakistan, then you only have one option. In Pakistan, we don't have any recruiters who are working there for Maldives because there are some uncertainties. Uh, there are two agencies here who get doctors from Pakistan. One is this Egyptian agency, and another is a doctor who is working with MedPlus company who is hiring doctors for resort. So you can get.
Yeah, in India also,
You can send
the
one
agency
doctor for
which I
Maldives
came
to
through
one place.
is a good agency. Uh, Try giving the number. So if you want, someone wants, you may contact me or I will give you the number to Dr. Waqas.
Thank you, Vigil. Also, conclusion is that yeah, yes, this is DFM. DFM. If you open it there on their
And one more thing
icon,
I wanted to say is that like some nurses like they don't want to be in a busy situation or like some people they already work in some other countries and they are tired like they want to have a relaxed duty so They are always welcome. Yeah, work in a health
Yes.
center and they
Now,
will learn. You will
anyone,
be.
anyone who want to know about some agencies, they can message me and Vigil also from India. If anyone I will post this video on YouTube also. Anyone who is watching this video, if they want to know, they can approach Vigil or me to know about. We will help them because I always say that. The good thing, the virtue, how can we do some virtue? The virtue is that if you give something very important to others, that is a virtue. The important thing for me and for Vigil and for everyone is our time. So we are giving our time for this for nothing. So we'll be just helping you guys out, and that was the sole purpose of making this live video. And I'm really
Yes.
thankful to Vigil, and that virtue
Yeah.
will
Thank you very much.
that
Thank you very
virtue
much
will
for an
count,
opportunity
my
to
friend.
go live with
That
you.
virtue will count, and I am really feeling very happy that you joined me. And
Thank you, sir.
this will be helping many others
My
who are
pleasure.
coming. Maybe we don't stay